My name's Sue Hogarth and I'm a public health consultant working for Tower Hamlets Together. Tower Hamlets Together is a partnership made up of Barts Health, East London Foundation Trust, Community and Voluntary Sector, London Borough of Tower Hamlets, the Clinical Commissioning Group and GP Care Group. Making Every Contact Count is a half-day training session giving the staff the knowledge, skills and confidence to support residents if they want to give up smoking, reduce their alcohol drinking, eat more healthily, exercise more and look after their sexual and mental health. It's not about telling people what to do, it's about picking up on issues that come up in a conversation and giving frontline staff the tools to discuss and help them. Now, almost 900 frontline staff have been trained in MECC across 70 organisations in Tower Hamlets. That's including the Tower Hamlets Together partners, but it also includes housing associations and schools. Now, here are some stories about how MECC has helped people who live and work in Tower Hamlets.
So I'm Shamus. I work with Network 2 and I'm a social prescriber. So the MECC program is a fantastic initiative. It's actually an integral part of what social prescribers do. The main role of a social prescriber is to signpost and refer patients to appropriate services, and the MECC program actually reinforces that. Not only did the actual training help with the role, actually it's an opportunity to sort of network with other organisations.
My name is Mohammed. I work for Tower Hamlets Adult Social Services and I work as part of the assessment and intervention team. MECC has allowed us to use different techniques and look into different resources in building people's confidence. Now it's all about trying to get people to maintain their independence themselves, trying to use local resources, family members, friends, the local community. It's just about making sure that people are aware of these resources, and part of obviously MECC has been to promote these things. So.
My name's Liz. I'm a senior worker for health and wellbeing at Problems Row. We're a homeless charity based in Aldgate East. I think one of the biggest things for me is it's really kind of boosted my confidence to have those conversations with clients. I'm constantly signposting people into for breathing tests or to the BBV nurse, or to services off-site like podiatry. And while motivational interviewing is something we do a lot on site, the MECC approach really gave me the confidence to talk more about health. I think it really helped, like knowing what the up-to-date public health messages were around that. A lot of what I heard in the course surprised me. I thought I knew, you know, how many pieces of fruit you should eat a day or how much exercise you should have. But actually, it's much easier to have these conversations when you feel confident that you actually know the right answers and the right advice. Our vision, way before we heard about MECC, was actually that we would be an organisation where everyone would feel confident to have conversations with clients about health and to signpost them into the support that we were developing on site. So when we heard about MECC, it was fantastic to know that we were actually in line with what the NHS and Tower Hamlets is doing, and that there was a really sort of targeted approach that our staff could learn to support clients. What we're hoping to do is also introduce an even more tailored approach to MECC and skill our staff up on sort of health services that are especially relevant to our client group, and in time hopefully become more self-sufficient in MECC. We really love to be making every contact count as long as we can. It's never going to be something that isn't relevant for us.
My name's Georgina Birch. I work in Merle Hospital. I manage the integrated care mental health liaison team. Okay, so we always ask lifestyle questions in mental health. It's been part of what we do. Obviously, lifestyle has an impact on your mental health, and things like more people mental health problems smoke than the rest of the population. So it's been a push that we need to be addressing these things.
So my name is Merle Simons. I'm lead health advisor with Barts Health and NHS Trust. Sexual health services are open access, and by and large we see a relatively young, healthy population compared to a lot of other hospital services. However, there were quite a lot of missed opportunities around addressing wider health and wellbeing needs. So having staff who are trained in delivering MECC interventions has really been a great asset for us. It's helped us to open up conversations with people who are primarily accessing for sexual health care, but it allows us to kind of really tackle contributory factors such as alcohol or smoking, which may well have a direct impact on people's sexual functioning.
So not only has it helped staff members within our team, also it's had an impact on patients, and knowing about all the services that are out there that you can tap into and refer into, and also bringing up conversations, how to go about changing people's lives, whether it be small, little changes make big differences to people's lives.
I had a client that I was once working with not so long ago. To put it bluntly, he was overweight, struggling with carrying out domestic tasks at home. Another thing that I referred him to was an organisation called Borough Gym. I did suggest to him to maybe look into some of the local gyms, but he said that he didn't feel comfortable. He didn't feel comfortable going into these gyms where everyone tends to be sculpted and muscular, apparently, as he put it. Whereas Borough Gym was probably more fitted for him. He's got more of his crowd round there, as he put it. And he's actually started going, and from last I heard, he's getting on really well.
I know when I was sitting there on MECC training, I was actually really kind of thinking about my own health. It was quite a good opportunity for me to think about the improvements that I could make, and that's some feedback that a lot of our staff came back and told us. One staff member mentioned to me that she thought that her 15-minute walk to work and back each day would count as her half an hour of exercise, and actually she needs to be raising her heartbeat, so she's going to be joining the gym next week.
I think there was quite a lot of confusion about the guidelines before starting, so people were a bit unsure about what to actually advise and ask people about. Yeah, I think the training's given people a kind of framework to work within, which is a lot clearer for people, and enables them to give kind of very brief interventions if needed, even if it's just providing a leaflet.
So MECC has really given us as an organisation an opportunity to tackle people's wider health and well-being in a way that we weren't previously. However, that we know in an area such as Tower Hamlets that there are various health challenges for a lot of people, particularly around smoking, around problematic alcohol use, and people are often unclear about how or where to access support. So by having a workforce that's trained to deliver conversations to people coming through our sexual health services, it's opened up opportunities for people to think about their health and their well-being and to take positive steps to improve their health. So MECC training has been fantastic for our workforce because it focuses across all staff groups. So it gets all of our workforce engaged in a conversation around health and health improvement. It's also given people confidence to have conversations around health issues in a way that you wouldn't necessarily think. So, for example, receptionists who, when people come into the service, usually it's just about taking patient details. But now with MECC training, people can have brief conversations around someone's health and well-being. They can offer signposting and information. For those who maybe feel anxious or concerned about MECC, about it being yet another thing to be delivering alongside other services or other priorities, it's really, really straightforward to do. It sits in really nicely as an opening conversation, and the fantastic thing is it engages the whole workforce.
Plays a big role in tackling inequalities in health within Tower Hamlets. It's a way of getting people to be aware, one, and then tap in and use those services to improve their health and well-being.
When you're dishing out this kind of advice on a day-to-day basis, eventually it kind of hits you too. So in terms of maintaining a healthy lifestyle, healthy eating, going to the gym or just participating in physical activities throughout the week, I'm advising people to do this on a daily basis, and it turns out to be one of those situations where it's like, do as I say, not as I do. But the more you drum it into people, the more it eventually drums into yourself.
Because it's given staff that focus on how they can improve their health, it's something that's being communicated to clients as well. We always try to lead by example. So say if we have a nurse on site offering flu jabs, we'll actually make sure that staff know they can do that as well. Where the staff take up sort of offers of health on site, clients are more likely to follow. and it's a lot easier for people to have those conversations about health services once they've benefited from it themselves.
But also we're seeing changes in people's own personal lives, and again, people are using MECC with their family and their friends. So it has a much kind of broader application to help improve the health of wider communities.
My name's Peter and I volunteer at Providence Row in the kitchen. So I deal with, I cook, and I'm also like sort of peer mentor. Like they're always helpful, like when it comes to health, because that's one of the things they do here as well. We talk about how it works, how it helps your body, how it affects you, and I've learned quite a bit since I've been here. I mean, I've only been here for 3 months. Certain things I didn't know, but yeah, we're getting there. We all have like that conversation. So we all sort of getting together, and we talk about healthy food. We go to the store and we work out what we're going to cook for the day, and it's mainly healthy. We all have like that conversation. So we all sort of getting together, and we talk about healthy food. We go to the store and we work out what we're going to cook for the day, and it's mainly healthy.
My name's Pete. I've been coming to Providence Row for maybe 3 or 4 months. I'm also a peer mentor in the kitchen, helping new clients learn to cook various different foods and methods. Ways I've had conversations with weight loss. I need to lose weight. There's people here that are encouraging me and helping me to find ways to help me lose the weight I need to lose. There's people here to help me find a way to eat the proper foods I need to eat to help me lose the weight that I need to lose as well. I've only just started getting involved with the health side of Providence Row myself. But since I've done that, Liz is always there, and she encourages us to, again, eat healthily and drink healthily and abstain from what's bad for me. But there is, like I say, there is always someone here, and there's a conversation. If I've got a problem with what I'm eating or drinking, Liz is there for me. If I've got a problem in the kitchen with what I'm cooking, Simon's there for me and advises me how to cook, so I can pass my limited knowledge on to new trainees and volunteers and stuff like that. Yeah, it's pretty good here, really. I've seen people come in here that only get 1 meal a day, and we try to make it the healthiest meal we can.